Do you have high blood pressure or are you worried about getting it? Welcome to this video on high blood pressure, also known as hypertension. Few glaring stats before we proceed. Approximately 76.4 million Americans over the age of 20 years have hypertension, and that roughly comes to 30% of the population, and only half of those being treated have it under control. And as many as 8% have undiagnosed hypertension. A low socioeconomic status, lower education level has been linked to poor blood pressure control. And access to the primary care physician's office has been linked with better outcomes. So hypertension is a common disease, but just why should you and I worry about high blood pressure? To everybody out there, there are many reasons why. A high blood pressure works on you slowly and increases your chances of getting heart disease, kidney disease, vision loss, or for having a stroke. Now this is especially dangerous because hypertension may not have any warning signs or symptoms. And once it develops, it can last a lifetime. So what is it? What is blood pressure? In simple terms, the force of blood or pressure against the wall of the arteries. We have two values, an upper and a lower. The upper is called the systolic, and it is the pressure as the heart beats. The lower is the diastolic, and this is the pressure as the heart relaxes. Now this is written as systolic over diastolic. Now traditionally accepted normal blood pressure is less than 120 millimeters of mercury systolic and less than 80 millimeters of mercury diastolic. However, when we come to the realm of hypertension, we make a few divisions. There is pre-hypertension and hypertension itself. Pre-hypertension is the systolic of 120 to 139 millimeters of mercury, or a diastolic of 80 to 89 millimeters of mercury. Next comes hypertension. It itself is divided into two stages. Stage 1, a systolic of 140 to 159, or a diastolic of 90 to 99. Stage 2 is a systolic of greater than 160. That's pretty high. And a diastolic of greater than 100. That's also high. Now, if you don't take any medication, but you do check your blood pressure, take a moment and ask yourself, which stage are you at right now? Moving forwards, we have to keep in mind that medicine does keep on changing, and normal values today may not be normal tomorrow, and a normal blood pressure values of one person may be considered high or abnormal for the other. So keep in touch with your doctor, who is the right person to make that decision. Okay, so now will be a good time to have a look at a few terms. White coat hypertension and masked hypertension. White coat hypertension. This is when your home measurements are always good. However, at your doctor's office, your readings are always high. Now, masked hypertension is the opposite. Your readings are good at the doctor's office, however, the values are high at home. Do you have any of this? Whatever the case, it is imperative to keep the discussion going with your doctor and find the best course of action for yourself. So there you have it with a quick overview of what is hypertension. But in the coming videos, we will have a look at the causes of hypertension and what could go wrong if your blood pressure is not controlled. And then we will look more on how to bring it under control even without medication. Stay tuned with the channel, or you can find the links below in the description. Anyways, click on the subscribe button to get the latest info on health-related topics. Give a thumbs up and do share your experiences and thoughts. What is your struggle with hypertension? We would love to hear your story. And always keep in mind that your doctor's goal is to prevent you from taking medication. But if you have to, you must take them properly. My friends, stay healthy and stay safe.